Hi, friends. So many people often ask me questions about COVID and how to navigate their health because I'm a public health professional. And I will tell you, it's been a difficult journey for me over the past few years as I've seen the shortcomings in our federal agencies. And also, as I have learned about the importance of early treatment and the challenges of obtaining that early treatment. There's been a lot of frustration that I've experienced, but I've also had a lot of victories in discovering solutions. And so I wanted to begin a series of tips, quick tips that I can provide to you to help you also navigate the COVID situation, be able to find treatment where you need to find it, how to access medications you need to access for a cost that is reasonable, and just in general, how to take ownership of your health moving forward so that you can be the best version of yourself that God intended you to be. So today I want to refer you to the FLCCC, and this group of frontline doctors has basically come up with protocols on how to treat COVID, how to prevent COVID, how to deal with long haul COVID, and also how to address vaccine injury. And it is an ongoing process of research and experience, but it's a whole group, a collaboration of multiple doctors from different areas who are working together to come up with the best ways to tackle the disease of COVID and all of the aftermath that many of us are dealing with. And as many of you might know, I have dealt with long COVID the last 2 years. And so I myself have begun the protocols that they have recommended, and they're constantly updating their protocols for the various issues that you might have related to COVID. And so in this particular organization, their focus is the best care possible. And they are not biased by big pharma. They are just doctors who love to be doctors. We're tired of being held back by the governmental agencies and by others in their field who were telling them that there was no way to treat patients, that you had to wait until the very end of life, and then there were only a few options and they weren't safe. So these doctors came together and they have saved probably millions of lives. And so I will put the link to their website for the FLCCC. And it's a wonderful website. Many of you may have heard of it, but you may not fully know how to navigate things. So I wanted to help you a little further on how to do so. So on their website, they have protocols for prevention. They have protocols for early treatment. They have protocols for hospital treatment. And they also have long COVID treatment. And they also have protocols for vaccine injury. And as I said, this is ongoing because there is not a lot of research on vaccine injury because there isn't a lot of recognition yet in the medical community that this is a problem. But it indeed is a problem. React 19 is an organization of vaccine injured individuals, and they have put together over 1,250 case studies and other studies documenting all kinds of injuries from the COVID shots. And so this is indeed a problem. And so FLCCC, this organization, is committed to doing everything they can to help people get healthy and to help those who have been injured to recover. And so I wanted to refer that to you. I also wanted you to know that they have a list of pharmacies. It is not all inclusive, but it is a list of pharmacies of those who have put themselves on that directory. So you know that they will prescribe drugs such as ivermectin and hydroxychloroquine, which are indeed evidence-based, and they have a series of research studies backing up a multi-drug approach to treating COVID, including those medications. And you can see all of that data on their website. You will also see a directory of physicians and companies of physicians who are freedom-loving doctors who are willing to treat. And The reality is that you do have to do your due diligence. But having said that, it's a starting place where you can go on the directory by state and see the doctors or companies of doctors who are willing to treat, and then you can interview and find the right physician for you based on your finances, based on just compatibility and other factors that you're looking for. So that is a wonderful resource for people. One last thing that I wanted to mention in this particular video is that it's important to know where your compounding pharmacies are that prescribe ivermectin, hydroxychloroquine, and low-dose naltrexone. Low-dose naltrexone is part of the protocol for long COVID, and it's an important drug that helps modulate the immune system. It has very few side effects, and a lot of compounding pharmacies will compound the low-dose version of that for that purpose. But ivermectin and hydroxychloroquine are more difficult, and not every compounding pharmacy will compound it for you. A lot of physicians have found that their prescriptions are denied by the vast majority of pharmacies. Retail pharmacies are most assuredly denying doctors in terms of filling prescriptions. There are a few exceptions, and then compounding pharmacies are also denying them. However, if you do some due diligence ahead of time, you call around to local compounding pharmacies or ones that are relatively close to you, find out if they prescribe ivermectin or not if they prescribe it, if they compound ivermectin and hydroxychloroquine, and if so, how much they charge for it. Do they do mail deliveries? Find out that information ahead of time so that when you work with a physician, they have more options, because a lot of times they'll use a mail order pharmacy like Honeybee or some other mail order pharmacy, and it could take a little bit longer and it might be a little more expensive. And for example, the price range for ivermectin that I've seen has ranged from $77 for a week-long treatment to upwards of $400, and some places even more than that for 1 week of treatment. So if you know ahead of time where your pharmacies are that are relatively close to you, not only can you help the doctor more quickly get you your medication, but you're also armed with information about cost and also able to help other people be able to connect with pharmacies. So the pharmacies obviously don't have physicians to prescribe, but when you go to the directory and you find a doctor, you can bring up to that doctor ones that are close to you that are good cost, that are well priced, that you found, and it makes the process of receiving your medication much quicker. So those are some recommendations. The FLCCC is a great place to start. And so I wanted to bring that up to you. They have a lot of research on their website as well about the multi-drug approaches that they take. It isn't just one, it's many different factors and drugs. And it's kind of like you have a menu of different drugs and vitamins for each circumstance, whether it's prevention, whether it's active COVID or long haul or vaccine injury. And some of it is a bit of trial and error depending on your body, your immune system, and how you're responding to treatment. And so they're a big believer in evidence-based medicine, but they also have found that many times we have to personalize it to that person and their particular risk factors. So I hope that's informative and helpful for you. I plan to do more of these videos, and I hope that you will find these tips helpful for you in navigating your own health journey, and to remember that God gives us a way forward, that we're never stuck, and that even when we're dealt with challenges in life, there's always innovation and there's always courage. There's people who are willing to stand and do the right thing for others. And there's, I believe, a way forward in transforming medicine in the way that it's practiced from the perspective of those of us who are willing to find a better way of doing things and a better way of treating people. And so I know that these are wonderful doctors who are running this organization, and I think this is a great starting place for many of you who don't know where to go. Another organization that I'll quickly mention is React19.org, and that is for the vaccine injured. They're run by the vaccine injured and some who are dealing with long haul COVID, but they have a list of over 1,250 studies on injuries. So you can see all the different issues that arise and why it takes a little trial and error and personalized medicine at this point in time, because we don't have larger scale studies, because of the lack of acknowledgement of the problem in the medical community thus far. So anyway, God is with us, and we all have the tools that we need and the help that we need when we come together and we work toward a healthier way of being. And so I hope that's helpful for you. I bless you in the name of Jesus, and I hope that this is helpful and that you have a wonderful day.